The advertising messages in this episode are brought to you by Biologics by McKesson. Biologics by McKesson is a specialty pharmacy with patients at its heart. With 28 years of experience connecting cancer and rare disease patients to life-changing medications, our mission is to simplify access and deliver personalized care that helps patients achieve the best possible outcomes. Learn more about how we support patients and are a true ally for their providers at biologics.mckesson.com. You're listening to the Oncology Nursing Podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast. Hello, and welcome to the Oncology Nursing Podcast. I'm your host, Stephanie Jardine, Oncology Clinical Specialist at ONS, and today we are talking with Dr. Michelle Malika, Senior Advisor of the Office of Cancer Survivorship at the National Cancer Institute, which we'll call NCI from now on, in Bethesda, Maryland, about how nurses can tailor survivorship care models for their individual patients and the framework for building custom models. Michelle is presenting on the topic at the 47th Annual ONS Congress in Anaheim, California on April 28th. Thanks for joining us today, Michelle.
Thank you very much for having me.
So NCI's definition of survivor recognizes the many types of survivors who overcome hardships or life-threatening diseases. Can you tell us a little bit about their definition of cancer survivor?
Absolutely. So the National Cancer Institute's Office of Cancer Survivorship defines a cancer survivor pretty broadly. So an individual is considered a survivor from the time of their diagnosis through the balance of life. The definition of cancer survivor recognizes that there are many types of survivors, including those who are living with cancer and those who are free from cancer. And it's really a term that's meant to capture a population of anyone with a history of cancer rather than provide a label that we know may or may not resonate with everyone. And I would just say, regardless of the definition, we do know that most people who experience cancer are profoundly changed by their diagnosis and have very unique needs.
Thank you for that. So as our nurses that are listening to the podcast, they're probably working with patients in all different age ranges and all different places in their cancer journey. And survivorship care should definitely be tailored based on each survivor's individual needs. So what are some specific types of cancer survivors?
Sure. So we can start by age and look at pediatric and adolescent and young adult survivors. We know that individuals who are diagnosed as children with cancer have a high risk for late and long-term effects a long time after their cancer diagnosis and treatment are completed. They have a higher risk for subsequent cancers or newer cancers. They also have challenges transitioning from pediatric to adult healthcare and within the healthcare system. Adolescents and young adults, or the AYA cancer survivor population, is a really unique population because they're growing and they have a lot of growth changes and developmental changes in addition to tackling their cancer and the impact of cancer and its treatment. So adherence to long-term survivorship care is really challenging for this population. And there's a lot of psychosocial impacts amidst these key stages in their life development. And I would say that goes all the way up to older adults who have a history of cancer. We know that this population of older adult survivors is growing exponentially because of the aging of the population, but also advances in treatment and in supportive care. Older adults with a cancer history or survivors often have multiple chronic conditions or other comorbid conditions that occur in addition to their cancer. And so it's really necessary to integrate geriatric care into survivorship care with primary care and geriatric oncology. And often coordinating care for this older adult cancer survivor population is complex and it's challenging. And above all, there is a need to really support caregivers and families who are supporting those older adults with cancer. I would say another key population that we often focus on is rural cancer survivors who have perhaps less access to follow-up care during and after treatment. And they often experience less planning for survivorship care. So there's gaps in transitions after treatment and as they're experiencing these late and long-term effects. We have challenges engaging primary care in rural settings and accessing community resources. And so there's really a need to support the rural cancer survivor through supportive self-management so that they know when to call, who to call, and when. And then finally, there's this growing population of individuals who are living with advanced and metastatic cancers. And these are the populations of survivors who might cycle on and off treatment or have periods with and without active disease. Some of these survivors are treated with novel therapies. So there's a lot of managing fear of disease progression and even uncertainty in terms of prognosis or awareness of their prognosis. But above all, this population often has a unique experience and symptoms that are managed through complex care among lots of different providers.
So definitely a lot to take into consideration and a lot of complex cases that, you think you're done with all of your cancer treatment where there's all kinds of complexities. But the reality of survivorship care is that those complexities continue.
Absolutely. And I would just say that so much of our work at NCI is informed by what's happening clinically. And as an oncology nurse who worked at a cancer center for a long time, I saw that. I saw the gaps that happened while people and individuals were being treated with cancer, but then as they finished. And so even your earlier stage cancer survivors who have completed treatment, they still have a lot of uncertainty, a lot of need for follow-up care and for management of their symptoms. And so it's really important to consider their needs as well.
So back to the populations, are there specific needs that nurses should consider for these different populations?
Absolutely. So oncology nurses and advanced practice providers have a really key role in preparing patients and individuals for survivorship and caring for survivors. Nurses can help coordinate care among multiple providers. They can assess for needs and manage needs and support caregivers. It's also really important to make sure that you're assessing for psychosocial issues and needs for support, in addition to things like screening for financial hardship and for the financial impact of cancer and its treatment. But above all, there's really a need to tailor survivorship care based on these specific needs. And the nurse plays a key role in understanding what the specific needs of each individual survivor really is.
So what are some of the nursing considerations then for developing an individualized survivorship care model?
So really, the nurse and the care team need to develop a plan for the survivor that's tailored based on their specific needs and specific factors. And that includes things like risk for recurrence, any other chronic conditions that the individual is experiencing, risk for late and long-term effects, and that includes physical and psychosocial impacts, any health risks or risky behaviors like tobacco use or alcohol use, their access to care, their health literacy and their knowledge, as well as their presence of social support and caregiver support.
Okay, thanks. Lots of good things to think about and remember all those pieces that are going to be important to include in that survivorship care. So, Michelle, what are the essential components of a survivorship care model?
So it probably would be helpful if I describe what a model of care really is first. And that is what type of care should be delivered when and to whom and with what providers are involved in that survivorship care. We know that survivorship care should be tailored to the needs of each individual survivor, but there are some critical components of survivorship care, and that includes surveillance for recurrence and new cancers, prevention and surveillance, as well as management of the physical and psychological impact of cancer and its treatment, management of comorbid or chronic conditions, as well as health promotion and preventive care. And it's important to remember that these components of care often involve multiple providers and require care coordination throughout that survivorship care.
Well, since we talked about models, are there different models of survivorship care?
There certainly are. Some of the most common models of survivorship care are the oncology-led model, the multidisciplinary survivorship care model, shared care, and then risk stratified care, which we talked about. I'll go through each of those one by one just to explain a little bit about the pros and cons of those models. So an oncology-led model is where oncology providers follow survivors for a long time during and after treatment. They typically are in charge of the survivorship care. And while this is advantageous to survivors, and survivors often like to be followed by their oncology provider and their oncology team, it isn't necessary for all survivors. So some of your earlier stage survivors who have completed treatment and have low risk for recurrence and other issues could be safely transitioned from the oncology-led model. It's also not sustainable for every survivor to be followed by the oncology team. Then we have multidisciplinary survivorship care, which often occurs as a survivorship care clinic and integrates care from multiple providers, including primary care or internal medicine, oncology, often physical therapy and rehabilitation services, and some other complementary medicine, as well as psychosocial services. This is really important for higher risk survivors, sometimes head and neck cancer survivors who have oral complications and long-term symptoms, or others may need to be treated or seen long-term in a multidisciplinary survivorship care clinic. The con here is that survivorship care clinics like this often require a lot of resources and aren't available to all survivors, nor are they necessary for some of our lower risk survivors. And then we have what is called a shared care model, where survivorship care is a partnership between primary care and oncology. And we often see this as sort of an optimal model of care where the primary care and oncology teams are really sharing the care. They're communicating and coordinating care well so that the primary care providers are handling certain aspects of care like preventive care and health promotion. And the oncology team is really monitoring for recurrence and second cancers, as well as some of the late and long-term effects.
Thank you for describing those. I think it's really interesting that there are so many models. You think we're putting together a survivorship plan for a patient and what is this going to look like? But there are so many things to take into consideration. So for a nurse who has a patient that they're wanting to make sure that the survivorship plan and the model is started, how would you tell our listeners what the best way to decide which survivorship care model would be right for a patient?
Sure. So I think oncology nurses really play such a key role in assessing the needs of a patient and communicating that among the healthcare team. And so the nurse really needs to be able to say, what are the needs of this patient? What is the access to care for this patient? Are they going to be able to come back to a cancer center for follow-up care? Or do they need to reintegrate with their primary care provider? Do they have health insurance or other payment issues that might impede their ability to seek follow-up care outside of the cancer center? And really, the nurse plays a key role in helping to connect the patient with resources and to know that this patient has a high risk for recurrence or for symptoms based on what they're already experiencing or the treatments and cancer history that they have. And so really understanding and communicating with the patient and the individual and the family in terms of what their expectations and goals of care are moving forward, and suggesting potential models of care based on that. That is really the key to having care and survivorship care that meets the needs of each individual patient.
The advertising messages in this episode are brought to you by Biologics by McKesson. At Biologics by McKesson, we do much more than just dispense medication. We provide compassionate, experienced clinical care for patients with the help of our partners. We improve the lives of specialty care patients by creating personalized care plans based on their individual needs. We help patients navigate the complexities of their disease by connecting them with our experienced, high-touch clinical team. And we meet our patients' clinical, financial, and emotional needs. Bottom line, we're there for them at every step of their journey. And we're here for their providers too. Learn more at biologics.mckesson.com. So, Michelle, what are barriers that nurses might face in implementing different models of survivorship care?
So nurses often deal with challenges in terms of buy-in. So buy-in from both oncology providers and from primary care in implementing any one of these models. So often the oncology provider has an idea of how the survivors in their clinic or in their practice should be followed, whether or not that's based on evidence-based guidelines or based on the needs of the patient. And so often it's difficult to get patients and survivors to be transitioned out to primary care if that's what's best for them. In addition, it's often hard to engage primary care who may not have been present or engaged throughout cancer treatment and right after the diagnosis, but now they're playing a huge role in assessing for the needs of the patient in terms of symptoms and comorbid conditions. And then finally, coordinating care is a continuous challenge. So survivorship care plans, which we've talked about a lot, are a tool. And they were designed to sort of ameliorate issues with care coordination, but it really is a tool and a piece of paper that the nurse and the care team needs to use to be able to guide care. It's not the only thing necessary for quality survivorship care.
Okay. So in those barriers, you mentioned some challenges, and how can the nurse address or work through some of those challenges?
Sure. So it's often unclear who's responsible for specific components of care. And the nurse and the advanced practice practitioner can really help the survivor know who to seek care from and when. They can also help communicate between providers and coordinate that care. And there's a need for this ongoing provider education on things like guidelines, late effects and toxicities, as well as new treatments for survivors. And so the nurse plays a pivotal role in educating providers and the care team, as well as patients and survivors. And finally, the nurse really can help start the conversation early. So at the time of diagnosis, there should be a plan laid out for the patient as they're going through treatment, after treatment, in who they should see for what type of care and when.
I think that's such an important piece that you brought out, is that it needs to start at the beginning, and the role that the nurse can play in, getting that started and continuing that throughout their journey, their treatment journey and just the whole process. And I think it's important that our listeners understand that they have such a important role in improving survivorship care for the patients that they are taking care of. So can you talk a little bit more about the roles that maybe, whether it's the direct care nurse or the advanced practice nurse, has in integrating other members of the care team into this survivorship plan?
So the oncology nurse and the care nurse really is the one that's able to listen to what the survivor needs and be on the pulse of what they are experiencing in every moment. So the nurse is really with the survivor at all points along the care trajectory from diagnosis all the way through. And this is their key role, is assessing their needs, assessing their support, and then communicating this to multiple providers. And that includes supportive care, palliative care, which should be beginning early on after the cancer diagnosis, physical therapy and rehabilitation therapy, as well as any needs for psychosocial support. So really, you could see the oncology nurse as the hub and of the wheel with all of the rest of the providers around them. The nurse really has a key role in providing support for the survivor and for their family. And then the advanced practice provider plays a role in assessing and managing all of the physical and psychosocial impacts of care, making sure that the survivor is receiving the support that they need, and communicating the survivorship care plan and the plan of care moving forward.
Thank you. I think it's important for our listeners to, again, recognize their role and really take that to heart, that, they have a place in this, and they really are an integral part of developing these survivorship care plans and being part of this for each of their patients that they have.
I completely agree. I see nurses as a critical component in delivering the right type of survivorship care to the right survivor.
So you've given us a lot of information, and I want to ask you, what are some key areas that you've identified for future work in the models of care delivery for survivors?
So there is a need to really develop effective strategies to enhance engagement and communication and coordination between the oncology team and then providers who are not actively involved in the cancer and treatment journey. And that usually means primary care, but it could mean other community resources or other providers. We need to be able to develop a link so that survivors have a seamless transition for all of the different components of care that they need.
Great. Thank you. So, Michelle, you've given us a lot of information today, and I can hear how excited you are about this topic and the importance that this topic is. So as we come to the end of our podcast, there are just a few questions that I always end our podcast with that I'd like to ask you. And the first one is, what are common misconceptions about survivorship care models?
People often believe that one size fits all for survivorship care, that we can put a specific cancer type or individual cancer population into a box for what type of care should be delivered. And that's just not the case.
Next, what's something about survivorship care models that's not often discussed, but you wish people knew more about?
I don't think there's enough communication between providers, nurses, and survivors early enough about what needs to happen during and after treatment in terms of comprehensive survivorship care. I also think that survivors need to know that there are transitions in care between providers and changes in their trajectory that happen, and they're dynamic throughout survivorship. That means that they don't have to stick with one model of survivorship care for their life. They can transition between an oncology-led model and a shared care model based on their needs.
What additional training or education do oncology nurses need to develop survivorship care models that meet their patients' need, or understand and be able to identify the appropriate one for their patients?
So oncology nurses need to understand the key components of survivorship care, but they also need to know what the patient is experiencing and how to assess those needs so that they can help inform the care team of when patients and survivors need to be seen, by whom, and for what type of care, as well as what the guidelines are, if there are guidelines available for survivorship care, for follow-up surveillance, and for monitoring and management of any late and long-term effects or other comorbid conditions.
And what are some additional resources for our oncology nurses who are listening and want to learn more?
So the Oncology Nursing Society has several resources online about the needs of cancer survivors, and there's lots of continuing education courses on survivorship. I would say that if they are looking for resources for patients, the American Cancer Society, as well as the National Cancer Institute, has resources for patients, for survivors, and for caregivers.
Well, Michelle, I'm really excited for your session at Congress, and I'm sure that those listeners who are going to be attending are going to be just as excited and want to hear more about this. Do you have any final comments for us today?
Thank you so much. I am so excited to be at Congress and to listen to what the oncology nurses are experiencing clinically and with their survivors. I would just end with, we need to listen, and we need to know what our survivors need and what they want and be able to match that with comprehensive survivorship care that they really need.
Great. Well, thank you so much for being with us, and I look forward to your presentation.
Thank you for having me.
The advertising messages in this episode were brought to you by Biologics by McKesson. At Biologics by McKesson, many of our patients' journeys are lifelong. We make it easier for them by serving as a true partner, and we help strengthen the link between them and their providers. Reach out to us at biologics.mckesson.com to find out more about how we can help you get patients on therapy faster and help them stay more adherent. Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part of this episode by leaving a review on iTunes or wherever you downloaded your podcast. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org. The ideas and opinions shared in this episode represent those of the guests and not necessarily ONS.